Welcome to Healthcare Aptitude, where healthcare's thought leaders will examine ways to address the rising costs of care in America. We'll also examine how the latest advances in mobile apps are helping hospitals and health systems bend the cost curve and improve patient engagement.
Hi, and welcome to Healthcare Aptitude. I'm Tom Testa. Today's episode will be a bit different than our usual ones because of the new realities that we all face, both across healthcare and in our daily lives. I'll be serving as a moderator for a discussion on COVID-19 with three experts in the space from MobileSmith Health. Joining me today will be Jerry Lepore, CEO, Greg Jones, CTO, and Bruce Kennedy, VP Provider Development. Gentlemen, welcome.
Thank you, Tom.
Thank you. Thanks, Tom.
Tom, thank you for having us today. We appreciate the opportunity. It's a critical time, but it's actually an exciting time for us to figure out how we can help institute change in healthcare. Before we get started, though, we'd like to thank all of the folks that are on the front line in our hospitals and medical provider practices, as well as our emergency medical team, first responders that are working so hard to address the COVID-19 situation that we have among us right now.
No, absolutely. And as we all know, Jerry and folks, things are changing hour to hour, day to day. So just for the sake of context, we're recording this episode in early April. While our panelists today have extensive experience in and around hospitals and the healthcare system, we are not going to get too far into the weeds on the clinical side of COVID-19. You know, we're all seeing a lot of that in our daily news feeds. But instead, Jerry, Greg, and Bruce feel it's important to talk today about what this means for hospitals, health systems, public health agencies, and other healthcare stakeholders. Let's jump into it. The world has clearly changed, guys, and regardless of what happens with this current pandemic, healthcare needs to be prepared for these new realities for the long term. Can you share with me your perspectives on what this means? Jerry, let's start with you.
Yeah, Tom, it's a very interesting time, as you said, and I think that one of the things we all know is we spend a lot of money in our healthcare industry in America, and we spend that money in a lot of different areas. But in the past, our investments have been focused along the lines of treatment and correction and recovery in a lot of instances. And while that's been very, very good, you can see what the coronavirus situation has actually raised as awareness that a lot of the dollars that we need to be spending in the future will additionally be in the areas of prevention and mitigation, because it's individuals that can actually protect themselves and protect their community and protect society and the United States of America and the world against situations like this much better than the aspect of treatment and recovery, frankly. So I think we're going to see a lot of changes in the way we think about healthcare in the future, the way we think about our investments in the healthcare industry in the future, and how we begin to engage individuals to actually take responsibility for health, and that will help us in situations like these in the future.
Great. Bruce, anything to add?
Yeah, thanks, Tom. I think one of the areas that will probably be heavily impacted moving forward would be the area of hospital operational readiness. Hospitals base their movements, their behavior on protocols that are driven into the system and practiced and verified and practiced over and over again. And there really was not a model for a pandemic response. Typically, when hospitals look about preparing or registering, it's a limited biological event. It's a outbreak of some sort that's regional based. There's been nothing like this in the U.S. before, at least in many of our lifetimes, that bubble will rise to the level of a pandemic where every hospital in your area that you might normally call on for support and help or transfer cases to is also being inundated. So I think that future incident command training and future protocols are going to have to change to accommodate how do we ramp up relatively quickly in an environment where we as a hospital system or individual hospital is on an island by ourselves. And we can no longer rely upon either federal, state, or regional-based support. And what does that look like from an operational training and expense perspective? It's going to be interesting to see moving forward.
Yeah, no, it's clearly going to have a lasting impact, as both Jerry and you have described, across both operational and the industry as a whole. Greg, your thoughts on how this is going to impact the way, we ultimately use technology in healthcare?
Yeah, well, I was saying to my wife this morning how using the word comorbidity, talking to customers, you would know if somebody was in healthcare or not and how far they were in healthcare if they understood what that word is. Mm-hmm. And the future of healthcare, at least in the next 6 months, is I think that word will be known by a lot larger audience, which is kind of interesting. But it really forces, to me, that means that the individual patient is going to be thinking a little bit more about remote healthcare, a lot more. Mm-hmm. So if I need to talk to my doctor right now, do I have, where is technology? Do I have what I need ordered and delivered to me? Do I have an IoT device? Do I have a mobile app that can connect to those? Can I communicate to the healthcare environment properly with what I have? So if a doctor's wanting to see how is my breathing, do I have something that I can send to them? Can I put my microphone up to my chest and have them listen? Mm-hmm. So things like that are going to start introducing more remote type services that I think is today the healthcare industry would say, I can't trust that device I can make a medical decision on. I need to have a more scientific approach to make a decision on that patient. And with where we're at now, is there going to be more of a demand for reliable devices that a healthcare decision can be based on? And with that, then, to allow for that remoteness of care, and with that remoteness just brings on more opportunities of better care for individuals. Then you're introducing other types of care that maybe an individual doesn't have to be part of. Mm-hmm. Maybe if I had those devices and they were more intelligent, then I could do a little bit more machine learning. And we've seen in the past where some of those machine learning capabilities have identified issues sooner than just somebody who is just using core data from that patient, but doing a little bit more research. So I'm seeing that remoteness and device-based information in the short term may not be relied on still, but will be provided in a lot larger sum. But moving forward, it might actually be more of a request from the patients to say, why can't I use this device? And why can't you trust that this device is something that you can make a decision based on?
Right, great point.
Tom, while our situation is unfortunate, as you can see, the three of us really believe that great things can come from bad times. And we really expect and I believe that this situation is going to be the impetus to drive some really, really amazing change in the healthcare industry on a go-forward basis.
Good point. Yeah, no, absolutely. And we're already starting to see that, I think, especially with MobileSmith Health. Greg, too, you were just talking about this remote, capabilities here. And again, I'll start with you, Greg, and I want to also hear from Jerry and Bruce, but how have the realities of this pandemic impacted MobileSmith Health as a health IT company when it comes to telecommuting, right? This also impacts things across the customer and the client side as well. So focus on working with clients through virtual education and other means like that. How has this impacted MobileSmith Health as a health IT company?
Before this all happened, we had a 3.5% unemployment rate over the entire economy. And in IT, at the level that we are in health IT, I kind of got the feeling like our unemployment was at a -1, maybe negative 3.5% to try to find the right staff. Mm-hmm. So one of the attractive pieces that we had was we could find the best staff anywhere. They didn't have to be in the local area, but do we have the right tools to to make sure we have the best solutions and the best way of communicating as a team, even though we're remote. So when this happened and we went self-quarantined, it was a Wednesday we made the decision, and on Thursday we had technically we run Scrum processes, for example. We did our stand-ups in the morning. We just got on our teleconferencing software, and nothing has changed from the daily workforce perspective. Mm-hmm. I understand all the frustrations of an environment that doesn't have those teleworking tools already in place, but because I wanted the attraction of a staff I wanted the flexibilities to have a good happy home life as well as a technical work life. We wanted to make sure that they had the best tools. So that was nice. That was like one of the silver linings in this. But I do understand from the IT staff. I mean, the healthcare providers, they get all the credit in the world that they deserve. But nobody ever talks about the IT staff that's making sure that the phones are working, mm-hmm. that all the machines are still working, that where the heck is that one asset that I need to find. I thought it was here on the second floor. Where's it at now? I hear it's on. So having that asset management pieces in place, making sure that's up to date, making sure that that data is uniquely identified and available to the people that need it. There's a whole lot of support staff at the hospital that's the guys I talk to. Mm-hmm. Those are the guys that I always say we're treated kind of like the phone company that once the phones are working, nobody thinks about the phone right. company. But when I can't get that dial tone, well, all of a sudden the phone company is the most important thing in the world.
That's right.
So a lot of goes out to the IT staff, which I also know is working their darndest as well. So they get some credit, obviously, but of course the healthcare staff gets the full credit. But I just wanted to say that because I don't hear that enough on the news and on the podcast. But yeah, I mean, for us, it has not been impactful at all, because we were already ready for the remote workforce that was needed.
Great. And Bruce, how about work on the client side?
Well, definitely, Tom. First, let me echo Greg's comments. I think what Greg is saying is not all heroes wear scrubs and masks when it comes to dealing with COVID in a hospital environment. And I agree completely. The support systems that as we work with our current hospital clients and with some of our other future hospital clients, one thing we've heard is that they are getting amazing support from their IT and operational support systems on the front lines. They are working very hard, and I think one of the things that I've always said, in answer to your question directly, has been, listen, we at MobileSmith Health, we're not a technology company that does healthcare. We're a healthcare company that develops technologies to support patients, providers, hospital systems. And I think that's been really borne out in the last probably 4 weeks or so as we've worked with our hospital systems, helping to support them in any way that we can. And we've been able to ramp up and develop mobile applications, support applications to help hospital internal teams communicate better with each other, to help hospitals better communicate with their patients and their community. And we've done that in an amazingly responsive way in a very short period of time, and done it in a way that is almost seamless to the hospital themselves. And so I'm really proud of the fact that we've been able to showcase our technology and rapidly deploy it at a time when hospitals are looking for as much support as they can possibly get. And obviously, anything that we can do that supports internal communications between leadership and nurses, and leadership and providers and nurses, and that entire ecosystem helps overall support the safety of those employees within that environment. And so we're really proud of that.
That's great, Bruce. And I definitely want to revisit that topic that you were just talking about, how you're assisting hospitals during this time. Before we do that, Jerry, I wanted to jump back to you. Someone who's pushing the leadership side and moving the mission of MobileSmith Health along. How has this pandemic affected the way you're doing business?
Well, Tom, I'll be short because Bruce and Greg covered most of the ground. I mean, we're called MobileSmith, but frankly, from our perspective, we could have been called Mobile Jones with what Greg has done to allow us to work remotely so Well, I think the biggest thing that we see is that, in fact, it's brought the team closer together. We've become more engaged with what we're really about, which goes to Bruce's point that we're a healthcare company that provides technology solutions. And in fact, in this time frame, while we've gone to 100% remote operations, we've been more engaged with our partners. And I like to look at it that way. We've become more of a partner to our hospital friends. And we've actually flipped our product set. So we've gone from delivering more operative and preoperative mobile solutions to delivering COVID response solutions into the marketplace in a matter of days to weeks. So I think all in all, it's been different, but it's been amazing. And I think that we've responded really well, and our clients have responded extremely well to our change and our movement.
You're listening to Healthcare Aptitude on Healthcare Now Radio, and I'm Tom Testa. I'm here with Jerry Lepore, Greg Jones, and Bruce Kennedy of MobileSmith Health, and we're addressing the COVID-19 health crisis. Now, Jerry, you and Bruce both hinted at that change. You talked about that change over the past month or so, how MobileSmith has quickly shifted focus, right? Now you're set to help hospital customers address COVID-19. You touched a little bit about that, but can you tell us a little bit in greater detail about that launch and what's happened to date?
Yes, certainly, Tom. It's that's the amazing part of this. We look at ourselves as situational, and we look at trying to make sure that we're on the forefront of delivering what our clients need at any specific time. And certainly because of this pandemic, the need changed overnight. So we responded in a matter of days. We came together and said, what can we do to actually play a role in helping folks move through this problem? And in a very short period of time, Bruce and Greg and the team brought together some ideas to develop two key apps. And the first one is called COVID Response Staff, which is an application that helps hospitals primarily and their staff and volunteers get information and communicate back and forth on how to deal with the situations they're facing in the hospitals. The second one is called COVID Response Community, and that's an app that helps the hospitals deal with their patients and community about the situation and how to deal with it most effectively. And I'll jump the gun a little bit. We're very quickly going to bring a third app to market soon. And we'll continue to do this throughout this period of time when folks' situation have changed and they need help with COVID-19 type support. The amazing thing about it, in a remote world, we were able not only to bring these applications up and live in a short period of time, but we can deploy them in less than 3 days in a hospital setting, which is
fantastic.
Amazing.
That's fantastic. That's fantastic. And Bruce, to jump over to you, how are you making things a little bit more, well, not to say easier for these providers to jump on board, but talking about the things you're helping with in terms of licensing fees, et cetera?
Yeah, definitely, Tom. So one of the things we looked at very carefully was bandwidth at hospitals currently. Mm-hmm. And as we've talked to our current hospitals, we actually think of it almost as a blessing that they've been able to take time out to talk to us, given what they're dealing with currently. And they've been very instrumental in helping us develop the product. And so what we've given back to them is a waiving of our normal licensing and subscription fees that we would normally be applied to our mobile application development and rollout services. And we are also looking at deferred billing for any implementation services. And so what we set out of the gate as a team was, hey, listen, because there could be some customization needed that we can't foresee in getting these mobile COVID apps stood up or launched, we wanted to make sure that we covered ourselves from just an out-of-pocket cost perspective on some of the extra work that had to be done. And so we've offered anywhere from $0 to $25,000 as an implementation fee for the entire first year. And we've waived all other fees that would be associated with licensing any of our COVID products. And I could attest to so far that we have not yet charged any hospital $25,000 for getting the COVID response app up and launched and stood up within their enterprise. And quite honestly, I don't foresee a time when we will. I think Greg can attest to some of this work. Much of the work that we've done with the apps in terms of integration has been authentication, security related, making sure that, especially for COVID response staff, that anybody who's on the system is authorized to be on the system to see the internal communications. Beyond that, we've not had much integration complications, which supports Jerry's comment around being able to get these new apps stood up within your enterprise or environment within a 72-hour window period. Yeah. So we're doing everything we can to help these folks. We've deferred billing to the extent that we can, because we understand that procurement services are going to be inundated and focused on bringing in other equipment and services and products to support directly the delivery of care within those environments. And so we've deferred billing anywhere from 3 to 6 months so that this doesn't create a problem in getting your application up and running as fast as it possibly can.
Right. Greg, can you expand a little bit about the integration component and implementation, how that's been going? I know Bruce said things are going smoothly so far, but what's the reception and how has that been going?
We ask a very simple question up front, is do you use Office 365? And if they say yes, then we know that they probably have a Microsoft Azure Active Directory, and that means that we can implement OAuth capabilities with a federated connection to their Active Directory. And so if they say yes to that question, then it's like, okay, then we're going to spend the next probably 10 minutes to 1 hour with your IT staff to get that working with your Active Directory team, and we're rolling. And so we have the system already set up to really support that. So we have OpenID. We also have a federated service that some hospitals say, well, I only do SAML integration. Not a problem. We can do SAML integration as well. So, but it's really, at the end of the day, when it comes to mobile, and we've been living in this world for so long, it's how we built the world out. You are either, when you're using that app, if you're not on a Wi-Fi at the hospital, you are on APPtitude or Sprint's or Verizon's network. So you're on a public network. So everything has to be secure, and to ensure HIPAA compliance, we always do that. But then the new piece is now we're asking people to authenticate remotely. So the nice thing is that hospitals are doing their darndest to keep up with technology to allow that remote capabilities for authorized apps and for services. So Office 365 is normally where a lot of hospitals go first. And if I can do that at home and I can bring up an Office 365 login with my Active Directory, then we're just going to utilize that. So it really helps out a lot, but we have federated services in support of that. The only time we would have an issue is if a hospital is completely 100% not available externally. And then that's a bigger lift to get third-party federated services in place. But we have documentation on helping hospitals with that too, because we've done that in the past as well.
Great. And Bruce, let me jump back to you for a second. How has the response been with the new COVID app that you've launched? Are there specific hospital associations, and what's their feedback?
It's been great. Our first launch was Deaconess Health System. They're based out in Evansville, Indiana. They launched their app, and within, I think, a 3-day, 72-hour period, over half of their employees had signed on and were actively using the app on a fairly regular basis. So that was really exciting to see. Because of our relationship with Deaconess Health, we also had some interesting inquiries from the Indiana Health Association and our outreach to a number of other health associations, most notably our local North Carolina Healthcare Association, South Carolina Health Association, and Georgia Healthcare Associations have been very supportive in promoting the application to their members in their state. We are about to launch into a broader relationship with over 20 state-based healthcare associations across the country. So we're excited about that. And then we have a few existing partnerships that are very helpful in helping us communicate the value of the COVID response app series to their clients. Most notably, our relationship with APPtitude. Their healthcare division supports over 1,000 hospitals across the country. And so we're excited to partner with APPtitude in making available the COVID response series to their clientele as well. So we're banging away pretty much every day at outreach to make sure that as many hospitals as possible know that there is the COVID response series that can help support their internal staff communication, external communications as well. And we're pleased to see the response so far. Jerry alluded to it a little bit earlier. At least I think this is what Jerry was alluding to in terms of the COVID response series. We are about to launch a COVID attestation app as well that's part of the COVID response series. So a number of hospitals are beginning to require their employees to attest or sign to confirm that they are COVID symptom-free before coming on shift as a way to continue to protect their employees. And we're in the process of deploying a mobile COVID response attestation app that's part of the COVID response series for one of our hospital clients located in the Northeast. Which should be launched probably within the next 2 to 4 days or so. And so we're real happy that we're not just creating an application for the moment, we're creating a platform for the moment, and we're continuing to advance and evolve that platform as we see needs arise for our hospital clients and for the hospital industry at large in dealing with COVID.
Well, gentlemen, this has been a great discussion. Any final thoughts before we wrap up today's show?
The only thought I have, Tom, is once again, we want to thank everyone on the front lines that's dealing with this situation. They are truly our heroes, and our hearts and our minds and our thanks goes out to them.
Well said. Well, that's a wrap for this month's episode of Healthcare Aptitude. Remember to catch the show on Healthcare Now Radio every weekday at 7 a.m., 3 p.m., and 11 p.m. Eastern Time. For more information, visit www.mobilesmith.com. Send your questions to sales@mobilesmith.com. Thank you for listening, and everyone be safe out there.
Thank you for listening to another episode of Healthcare Aptitude, sponsored by MobileSmith Health. Be sure to tune in weekdays at 7 a.m., 3 p.m., and 11 p.m. Eastern Time on Healthcare Now Radio.